if we look at profits as the excess, what's left over of revenues minus expenses, let's look first of all at what drives profits. In order to look at what drives profits, we have to understand that in a senior community, we typically have to look at the fact that there are three primary sources of revenue. One is Medicare, and one is Medicaid, and one is private pay. And what drives each one of those is different. So let's take a look at each one of those. Medicaid revenues are important because they comprise anywhere typically 30 to 65% of a nursing facility's resident days. So there is a concentration of those revenues. Those revenues are important to the organization. What drives Medicaid revenues is really broken down into two categories. The first category I'm going to refer to as the base rate. The second category is the net quality assurance assessment fee. So let's look at the base rate first, what that's comprised of. In Medicaid, a provider's allowable costs are accumulated, and the rate is in part based on the allowable costs. To the extent that a facility is located in an urban area versus a rural area, there is an underlying thought that's supported in the Iowa Administrative Code that there's additional payments that go to those in an urban area. The theory being that the wage base there is higher than in a rural area. Another component is the overall census. Iowa Medicaid wants to pay for an efficiently run facility. So typically there's a factor, and it's currently 85%. If your resident days fall below 85%, then certain costs are adjusted as if you're at an 85% occupancy. And historically there's been discussion about whether that should be 85% or 90 or 95% or 80%. So the 85% isn't necessarily fixed in stone. That may adjust. Another category that impacts the Medicaid rate is called rebasing. So every 2 years, a facility's cost is taken into consideration for purposes of adjusting the payment rate. And that's based upon provider cost years that end in an even year. So a cost reporting period ending in 2010 or in 2012 or 2014, those costs will be used to recalculate the payment rate. If the costs fall in an odd numbered year, such as 2011 or 2013 or 2015, those costs, even though you need to report them, they do not have any impact on the overall base rate. So rebasing is an important aspect. The next factor comes down to case mix index, and there's really two of them. First of all, the case mix index is based upon a scoring system for residents in the facility. So that is a scoring system that's based in part on the resource utilization grouping, and in conjunction with the even numbered year cost report, last one on file, there's a facility-wide case mix index. Essentially what that means is that every resident in that facility, their case mix score was calculated to determine what the case mix index is for the entire facility. After that, then, at the end of each quarter, the case mix index for each Medicaid resident is measured. And the relationship between those is very, very important. To the extent that the case mix index for Medicaid is lower than the case mix index for the entire facility, then essentially costs are discounted. The overall allowable costs are first calculated. They are divided by the facility-wide case mix index and then multiplied by the Medicaid case mix index. So it's important that organizations understand that relationship. Where this is particularly important is a knowledge that if you bring on Medicare residents, in fact, you could be damaging your Medicaid payment rate. So you need to look at how many Medicare residents that you actually bring in. If you're low utilization, meaning you just have a few Medicare residents on an annual basis, that case mix index is carried on for a while, and if you have a heavy Medicaid population in your facility, it may actually be damaging to bring on Medicare residents. So providers need to understand that relationship and and determine whether in fact it really makes sense to participate in Medicare or not. The inflation index is something that happens in conjunction with the odd numbered years. So embedded within our economy is the concept of inflation, that costs increase on an annual basis. And to the extent that your base rate is only readjusted every 2 years, inflation is used in the second year to inflate those costs to theoretically what those costs are in a current period of time. That inflation index is something that the state legislature takes a look at and sees whether there's enough money in the state budget, and then accordingly they'll adjust that inflation index up or down. In some years it's actually been negative because there hasn't been enough money to go around. But that has a pretty big impact on the Medicaid payment rate. There's another concept called the statewide median costs. So every facility in Iowa submits a Medicaid cost report, and the median is found for the allowable costs. Those medians are used to set a maximum payment rate, actually called a cap. And there are two caps. One are for direct care costs and the other for non-direct care costs. So how costs are incurred throughout the state, not just for your organization, but statewide, are used to set your payment amount also. And if you're above that cap, then essentially you're out the difference of money. The state won't reimburse for that. So we've talked about the base rate, and the second component of the payment system comes about from the quality assurance assessment fee. And that works in both directions for the facility. One is there's a fee that's paid to the state of Iowa. The state of Iowa treats that as a cost for purposes of reporting costs to the federal government, and that increases the amount of money that the federal government pays the state of Iowa for its Medicaid program. So facilities share in those additional federal revenues. So there's both a revenue and an expense that comes in. And for just about every facility in Iowa, that results in a net profit per se. Now, organizations that are deemed small and those that are deemed to be continuing care retirement communities, they share in those profits a little bit more heavily than those that are not small and are not continuing care retirement community. So again, it's important that providers understand where they fit within that and what their net profits are. Obviously, those organizations that have a high Medicaid utilization, meaning if they have more residents in Medicaid than others, they're going to share more in those profits than those that are predominantly private pay and or Medicare based. So a lot of different factors go into the Medicaid payment system. Another thing that impacts the Medicaid payment rate is legislation. So it's important that organizations understand what's going on in the state legislative committees. Typically that's done through an affiliation with one or two of the trade associations in Iowa that are both pretty good on staying on top of what's going on, and with members that are knowledgeable and affiliate members, such as our organization, that are knowledgeable, and what's the overall impact for proposed legislation and what would that do for the Medicaid payment rates in future years. A couple more things that impact the Medicaid, your Medicaid payment rate is one, simply knowledge of the rules. And having a good understanding and contemporaneously capturing both allowable costs and identifying and eliminating disallowable costs, unallowable costs, that's very, very important. And to have the right accounting system in place and knowledgeable staff that go right along with that. Accounting systems for CCRCs can be complex because there's many different components. There are different departments and maybe different service levels. So there's current and most likely an increased future need for good, very high quality information. And it's something I'm in the process of writing a white paper on that we'll have on our website, or we'll simply hand out free of charge. It will give a good guidance, tell you what all the targets need to be to support, have an accounting and information system that supports the Medicaid payment system.